In a move that has sparked intense debate and raised serious health concerns, Gympie Regional Council has voted to remove fluoride from its water supply, marking the second such decision in Queensland within a year. But here's where it gets controversial. While the council claims this will save ratepayers $255,000 annually, health experts argue it could lead to skyrocketing dental costs for residents. And this is the part most people miss. A decision reignites the question of whether local councils should even have the authority to make such critical public health choices. The council's 5-3 vote on Wednesday came after over a year of internal debate and 15 years of fluoridating the region's water. This follows similar moves by Cook Shire Council in February and Cairns Council last December, both opting to eliminate or not reinstate fluoride. Is this a trend we should be worried about? Fluoridation has long been championed by major health bodies, including the Australian Dental Association and the Australian Medical Association, as a cost-effective way to improve dental health. Yet, of Queensland's 77 local government areas, only 23 fluoridate their water, though these cover the majority of the state's population, particularly in the southeast. Mayor Glenn Hartwig defended the decision, stating fluoridation had led to a 0.5% rate increase. If the state wants it mandated, they should foot the bill, he said. We're not catering to conspiracy theorists, we're respecting democratic dialogue. But is this a case of local control, or a step backward for public health? University of Queensland dental expert Michael Foley was sharply critical. Water fluoridation is a no-brainer in public health, he said. It saves far more in dental treatment costs than it costs to implement. Councils might save a little, but residents lose a lot in long-term dental health. He added, it's staggering that the state government hasn't stepped in. This isn't just about money. It's about the well-being of Queenslanders. The debate isn't just about costs. It's also about trust in science. Gympie councillor Alona Lan argued locals should choose what's in their water, citing countries like those in Europe that don't fluoridate. The science isn't settled, she claimed, drawing parallels to past controversies like smoking and asbestos. Maybe it's not as safe as we're told. But is this skepticism justified, or does it undermine decades of scientific consensus? Opposition leader Stephen Miles was blunt. If Gympie's kids end up with rotten teeth, I'll blame Premier David Crisafulli. He gave councils this power, and now they're making decisions that hurt families. Deputy Premier Jared Bleegey countered, local councils represent their communities. This is their call, but at what cost? Miles pointed out that $255,000 is a small price for preventing widespread dental issues. Queensland Health should step in and fund it, he urged. It's the children who will suffer. Resident Anne Robertson celebrated the decision, calling fluoride a carcinogenic byproduct and praising the council's move. Yet others like Hazel Watts were dismayed. It's for the children's teeth, she said. Dentistry is too expensive already. The council will now begin the $100,000 decommissioning process after a 30-day notice period, with completion expected by June 2025. But the bigger question remains, should public health decisions be left to local councils, or is this a matter for higher authorities? What do you think? Is this a win for local autonomy, or a dangerous gamble with public health? Let us know in the comments.